Thank you, Michelle. And Michelle is a little bit too modest. It is, the genesis of this idea comes from Michelle Bachmann. The work product is a member's work product. Generally, things come from outside, and we adopt them because we don't have time to do anything else in this city. But this is something that's produced with a lot of sweat and a lot of brain power put into this. It looks like the Declaration of Independence on purpose. And it has language and phrases from the Declaration as well as the Constitution. But it does lay out the principles of what went wrong, the violations of the Constitution that were consistent on the part of the people that were advocating for a National Health Care Act. They simply had a cavalier attitude about the Constitution, even though they took an oath to uphold it. And then it also lays out the things that we will do that are right, that protects constitutional principles and protects conscience clause from funding for abortion or expanding health care services to illegals. A whole list of things. It's the new rules of the road, so to speak. What we reject, what the American people have rejected, and the new parameters under which we will set up a new health care reform policy. And I would put this standard out. Meet this language. Every member that can philosophically sign this should, and I think many will, if most will on our side, maybe even all. But if they fit into these parameters, they can sign this bill or sign this declaration. But the first hurdle that I would ask those who have been for socialized medicine to get over is jump over this hurdle. Be willing to take the first dollar out of the pockets of the trial lawyers and lawsuit abuse reform. Then we'll know you're serious about really doing the right kind of health care reform for the American people. Thank you.